Hi, so you have now completed the theory element of Unit 4. So we have completed Unit 1, 2, 3 and 4 in the First Aid Response course. So I hope you've been enjoying it so far. So what have we looked at in Unit 4? So we have looked at CPR and what it is. Okay, so CPR is cardiopulmonary resuscitation, and I would say the beauty of CPR, if you can say that, is that CPR is the same for everybody. It doesn't matter if we're doing CPR on a 3-year-old, touch wood, on a 2-year-old, on a 1-year-old, on a 60-year-old. It doesn't matter who we're doing CPR on. CPR, cardiopulmonary resuscitation, always entails 30 compressions and 2 breaths, and it always starts with compressions. As first aid responders, we always start CPR with compressions. Okay, we need to comply with the chain of survival. We've talked about that quite a lot through the day. So we need to comply with the chain of survival. And as we know, there are 5 links. The first link is early access. The second link is early CPR. Then we need to access a defibrillator. We want the ambulance to come, and we want the patient to get post-resuscitation care in the hospital. There are the 5 links in the chain of survival, giving the patient the best outcome should their condition progress to cardiac arrest. So when do you do CPR? This is really important. There's no point in us teaching you how to do great CPR, which you're going to learn with the video now. There's no point in us teaching you how to do great CPR if you don't know when to do it. And it is so simple. We don't have to start checking pulse to establish life or death. Establishing life or death is really, really simple, and it's very, very stressful. Okay, so we need to keep it simple. If somebody is unresponsive, that is the first sign of death. If a person is unresponsive, they are very prone to choking on their own tongue, swallowing on their own tongue, choking their own vomit. So you need to maintain an airway in order to scan for breathing. So we can lift the head up, making sure that the tongue is not blocking your airways. And at that point, and this is actually called a head tilt chin lift. And at this point, we're going to scan for breathing. Again, the good thing about this is we do this for everybody, baby, child, adult. We do a head tilt chin lift. If a person is unresponsive, we then go on to check for breathing. We scan for breathing for 5 seconds, no more than 10 seconds. Why is this? This is because we don't want to be, we don't want the best recovery is early CPR and early use of a defib. We don't want to spend too long establishing breathing because that's just taking time off the chest if CPR is required. So 5 seconds, no more than 10. We simply scan for breathing. If the casualty is not breathing or only gasping, we start CPR. The Irish Heart Foundation, and this gives people a little bit of relief to hear this. It makes it easier. The Irish Heart Foundation state, if you find somebody who's not responding, not breathing, or only gasping, you need to commence CPR. Or if you're in doubt about breathing, you start CPR. Okay, so you do CPR when somebody is unresponsive, maintain an airway, check for breathing. If they're not breathing or they're only gasping, you need to do CPR. Agonal is not regular. It is not normal breathing. Agonal breathing is a sign, or gasping is a sign of cardiac arrest when a casualty is unresponsive. A gasp may sound like a snort, a snore, or a groan, and sometime may pass between gasps because they usually happen at a slow rate. Gasping is not regular or normal breathing. Please remember this. 40% of people who drop dead initially gasp, and gasping is a sign of clinical death. The heart has stopped. Okay, so now we know when to do CPR. To do good CPR, and the Phecc video is going to talk us through this. To do good CPR, we need to place our hands in the correct position between the nipple line. We need to push hard, we need to push fast. We need to allow total recoil. Really, if you need to consider that your hands are becoming somebody's heart until the heart can be restarted. So you push hard, you push fast, you allow total recoil. That means allowing the chest to come back into its normal position between beats, and you do 30 compressions and 2 breaths for everybody. To give your breaths, you pinch the person's nose and deliver 2 breaths, each breath over 1 second. It's a little different for a baby. If it's an infant under 12 months, what you're doing to give the 2 breaths is you're placing your mate over baby's mouth and nose. And when you're doing compressions, we're compressing for the smaller person at less depth. What we use, or a rule that we use in first aid, is for a baby it is 2 fingers between the nipple line for 12 months and under to do your compressions. For a child who is 12 months to puberty or thereabout, you're using 1 hand between the nipple line to deliver the compressions, and for the adult it is at least 5 to 6 centimeters. So we're compressing at a depth of 4 centimeters for a child, 5 centimeters for a child, and at least 5 to 6 centimeters for an adult. Okay, so you do CPR as discussed until the defib arrives. When the defib arrives, you stop what you're doing. You take the defib. If there's somebody there that can take over your compressions while you're setting up the defib, perfect. If not, you stop what you're doing, you press the universal on button, and you very simply follow the guidelines. You do as you're told. You may or may not be delivering a shock, and then you recommence CPR unless you see signs of life or somebody arrives to take over. When can you stop CPR? If you physically cannot do it anymore. When do you not do CPR? When injuries are incompatible with life, post-mortem rigidity, lividity, decomposition of the body. Okay, they're the times that you wouldn't, or injuries are incompatible with life. Okay, they're the times that you don't do CPR. Okay, the defib is very, very easy to use. You turn it on and follow the guidelines. Okay, cardiovascular disease is the biggest killer in the world, okay, accounting for approximately 10,000 deaths in Ireland every single year. So we need to know how to treat a heart attack, a stroke, and angina. Okay, angina is where the vessels in your body are restricting, causing symptoms very similar to that of a heart attack. A heart attack is a blockage of blood supply to your heart muscle. And then there are 2 types of strokes. There are ischemic stroke, which is a stroke caused by a blockage due to a clot in your brain, or hemorrhagic stroke, where a blood vessel has burst in the brain. Now, they are the 3 conditions: angina, heart attack, and stroke. Simple first aid treatment of angina is to reassure the casualty. You may need to ring an ambulance, and you may assist the casualty to take their angina medication. If they're presenting with signs and symptoms of a heart attack, it's an ME, a medical emergency. We do need to ring an ambulance and get a defib. If we feel that the person is having a heart attack, we are going to do the simple first aid treatment of a heart attack, which is Disprin 300 milligrams. Once we've read the back of the pack, because on the back of the pack, it says, do not give to anybody under the age of 16. Do not give to anybody who has an active bleeding ulcer. Do not give to anybody who has a blood disorder, or do not give to anybody who is allergic to aspirin. You're going to read those questions or talk to the casualty about those things, check expiry of the medication, make sure the dosage is correct, and you are going to hand the Disprin to a person in a little bit of water, and you're going to get them to drink the Disprin. Okay, if there's no water available, Dispirin is also chewable. Then simple first aid treatment of stroke is simply fast. We're going to check the casualty's face. If the person is not presenting with A on the AVPU scale and you are worried about them, or if they're behaving in any way like neurologically stranger than normal, okay, you need to do the FAST test. So you check the face. Is there anything unusual with the face? Is there drooping of the face? Can you see anything that is not usual for that person? Then you're going to get them to raise both of their arms up. You're going to help them to hold their arms in place, and then take your arms away and ask them to keep the two hands up. If one hand is dropping, that is a sign of a stroke. Then we do the S part of FAST. We get the person to say a simple sentence such as the sky is blue. If the speech is slurred, it is T, time to ring for an ambulance. We're hoping to comply with the golden hour. So we do the FAST test, we ring for an ambulance, we want a defib, guys. Okay, so that is Unit 4 of the book. So what you're going to be doing now is you're going to be watching the Phecc video. I hope you enjoy it. And there'll be a lot of practice with it, and then that will be day 1 completed. So from Pro Training, hopefully everything's going well. Please follow us on Facebook or give us a review. That would be great, and chat soon. Take care. Bye.